Today, we are shaping change with Dr. Amy. Hello, Dr. Amy.
Hello, Ross.
Been looking forward to interview you for quite some time. You do a lot of great work out there with transitions and aging and a long list of topics. How about you start off by giving us a quick introduction of who you are and what you do?
Thanks, Ross. I appreciate it. So I have a background in social work, a PhD in social work, and my focus has always been on midlife and beyond. And I have a particular love in the topic we're going to talk about today, which is caregiving, because I spent a decade caring for my parents in addition to my professional background on this. But I also do work with advisors to help them who, when they're working with people around these very important life issues, and I call them life transitions. And Ross, I say those are the stages, changes, and events that happen in our life. So it's really everything that happens. And we need ways to thrive when we're in the middle of all this change.
Well, I'm in the middle of caregiving for a couple generations, and
Mm.
certainly taking a parent and having to have those kind of conversations, it can be challenging. And I know we're going to talk about that, but before we dive into it, how about we start at the beginning? So if I'm looking at my parents or a parent and I'm observing, what are some of the signs where my brain should say, you know what, we may need some care here, may need to talk about this?
Yeah, that's a great question. And really what we're looking for when we're seeing is everything okay with our parents is we're observing changes that can be of some concern. So one of the changes often people will report is they notice their parents' clothes maybe aren't as clean or they're not as well dressed. Sometimes that's just a vision issue. So the thing I want to say to people is, we don't want to jump to conclusions when we see a change. We want to note it and then try to get to what the issue is. Another thing we want to look at is the home and say, does their house look like it normally looks? Is it organized and clean? Do you see a bunch of unopened mail? If you open the refrigerator, are you concerned because food is really old in the refrigerator? Do you notice changes in their ability to have a conversation? So they're not clear mentally. So these are some things we want to look for. And, I always say it's not like we're spying on our parents. We're just observing, we're being aware when we're interacting with them. Are there changes to be concerned about? And I have to mention the car, if your parent's still driving, take a look at the car. Do you see a lot of dings, a lot of issues? I know one of the conversations I had with my dad about driving came out of me walking around his car one day as we were going out, and I saw a big kind of a crease in the whole side of his car. And I said, Dad, gee, what happened here? And he said, I think I parked a little too close to something. So, that opened up a conversation, as you might guess. We had many conversations like that. So just by observing, we can pick things up. And then I know, Ross, we're going to dive into what do you do with all that information that you pick up.
Yeah, I just had the conversation about the car with my daughter while actually I was out of town. And when I came back, and she said, we're not going to say anything, but, and apparently there's a little touch-up work and some things that went on there that, I'm not the most observant one. But yeah, it's those little things, I guess, like parking. And what's interesting is listening to you talk, it's all of these they all seem like little things, but I guess it's probably the body of evidence where it isn't just one little ding or there's
Right.
an expired food item in the fridge. I guess you
Exactly.
probably see it loading up over time.
Right, because if you looked in my fridge right now, you might find some expired things, and I wouldn't want people to think it means I have cognitive issues. But yeah, it's the buildup over time. Like I noticed with my dad, one of the things was that he had a lot of spills on his clothes, that there were things happening. And I also noticed that he had a bit of an odor that he'd never had. And so, I had a tough conversation. I call these essential conversations, talking to the most important people about the most important things in our lives. And my dad had macular degeneration. So he had problems seeing. He couldn't see those stains on his clothes. And, he had stopped showering as frequently because he was a little afraid to get in and out of the shower because it was, he felt not safe. So we figured out how to make it safe. So it wasn't a cognitive issue at all. And that's why I say we can't jump to conclusions, but it may point us to things that we could help our parent with to make their quality of life better.
So I love the idea of not jumping to conclusions because you're right. It could be something as simple just as vision. And
Right.
that's, you can address that, you can fix it in many cases.
Mhm.
So let's say I spot this, right? And I have siblings or I have sisters-in-laws, brothers-in-laws. I'm the one who notices it. And now I've got to actually bring it up. So how do I approach my siblings?
So this is one of the trickiest things. I work a lot with families, and what I know is that everybody sees things differently. So don't be surprised if that's the case. That's, we sometimes expect our siblings to see the world like we see the world. And I think one of the best things we can learn is that we may have all come from the same two parents, if we happen to, that's true. And we may have even grown up in the same house, and yet we see the world entirely differently. And we think, how can that be? So what we want to think about is if you're the one who has the most contact with your parent, so you're seeing them on a regular basis, and maybe your siblings live farther away and they're coming, maybe 4 times a year. I'll be generous and say that often. What they're getting is a snapshot. So they're getting a picture. What you're getting is a movie. You're getting to see things change on a day-to-day basis. That analogy can be very helpful because oftentimes when they're visiting, your parent may rally for the day or for the visit because they kind of pull it together, they're excited. And so all of those things that you're observing on a regular basis disappear for this short visit. So what you want to do is potentially use that analogy with your sibling and say, I'm getting a movie, you're getting this snapshot. And when I see this movie, there's some things in the movie I'm concerned about. And oftentimes what I find is the siblings who aren't seeing it feel that the sibling who is exaggerating. So that's why having some, just very calmly explaining some specific things that you're seeing. And if your siblings still are not agreeing with this, buying into it, still think there's no problem, that's when you might involve a professional. And what you would do with the professional is you would ask them to do some sort of an assessment so that they can, and geriatric care managers are fabulous at this. They can come in and help assess where the issues are.
The idea of the snapshot versus a movie, I remember speaking with you previously when you mentioned that, and that was like my big aha moment. And I thought, I wish I knew that 15 years ago, because the way you explained it is the person rallies when they're around other people. So
Yeah.
there's adrenaline, there's excitement. So how they present physically, emotionally, psychologically, it's just not what is a normal day to day for them. And for the people around them, it's hard if they're just seeing the snapshot. I remember
Absolutely.
questions of, really? It's not, it
Yeah.
can't be that bad.
Right. And siblings are often really hard on each other with these things. And that's why you don't have to get into big arguments with your sibling. Try this approach, but then think about it. Is there a professional you could bring in? And again, now we have to be sensitive about what that means with your parent and all of that. But if as siblings you can't agree, there are other ways to get there. You don't have to just get into the locking of heads.
So the next step after that is now I need to approach my parent. So what's some advice on how I should go about that?
So I think this is to me one of the most important parts of being engaged in your parents' lives is thinking about how you approach your parent. And the approach really matters. It's not the content as much it is the approach. And think about, I always say to people, how would you want to be approached? So what I suggest is that we think about saying to our parent, I want you to know that I want to chat about something that isn't necessarily easy for me to talk to you about, but my goal is to support your independence and quality of life. That's what I'm interested in doing. So that's all I'm doing in this conversation, but there's some things I think it's important we talk about. So let's say you're seeing some of these changes. This is how I approached my dad. I said, Dad, I want to chat with you about something it's not easy to talk about, but it's because I love you and I want to support your quality of life. And I'm noticing a couple of things that seem out of the ordinary to me. And so, you can imagine that when you talk to your parents about the fact maybe their clothes aren't as clean or you've noticed some body odor, this is a hard conversation. And so we have to think about how this feels to the person receiving it and take that very gentle approach. I have to tell you, Ross, I've worked with a lot of people who they come in like, they're talking to a very bad teenager and they're going to straighten them out instead of to their parent. And, it doesn't work with our teenagers either, but with our parent, it really is not a great approach to have this sort of, I'm going to come in and take over your life approach. And it comes from fear. So to recognize our own concerns and that we want to do the right thing, but then we have to do it a little bit more gently.
I think sometimes the kids take this mentality that I need to parent my parent, but
Oh,
I don't think the parents actually see it that way, do they?
you can never parent your parent. So I always say to people, they're always your parent. That's why I had a gentleman say to me one time, he walked into his dad's house and he went over to the table and he grabbed his father's keys and he said, well, you're done driving. And I said to him, how did that go? He said, not very well. And I said, well, if I went in your house and grabbed your keys and said, you're done driving, how would that go? And he said, but there's no reason I'm driving fine. And I said, but your parent feels that way too. And they're an adult and we can't treat adults that way. Now there's a conversation you can have about driving. And can I expand on this one a little bit, Ross? Because I'd like to share, because driving is such a huge issue people get into about their fears with their parents. So I'll share how I didn't do this very well. And what I learned from it, it completely changed my approach and how I talked to people about ways they can do it better. So my dad finally did stop driving. He had 3 accidents in the last year he drove. Yeah, and the last one, the airbags went off. It was bad. And he and I were having conversations and he could not hear it from me. And my father was cognitively okay. So this is key. If my father had cognitive issues, I would have had to take different steps, but he's an adult that was cognitively okay. So, by the way, it was his girlfriend who got him to stop driving, which is kind of a funny little part of that story. So about 6 months after my dad stopped driving, I was driving him somewhere and he said, he was in the passenger seat and he said, so, I think I'm going to get another license and going to get my license again and get another car. And when I tell this story when I'm speaking, I always joke and say, now remember, I'm a professional. I knew how to manage this. So I turned to my father and I said, you got to be kidding me. And my father sat up in the car and he said, well, I'm an adult and I want another car. I can get another car. And so at that moment, I had this aha that I don't know why it took me so long to get. And I realized that what I had done was never acknowledge how this must be for him. I always dealt with the practical. So my father lived somewhere where he didn't really need to drive. So there was van service, he could walk, there was inexpensive taxis. That was my focus on the practical. And what I missed consistently was addressing the emotional. And so what I said to him at that moment was, Dad, I love to drive. I know you love to drive. I can't imagine what it must be like to not be able to drive anymore. And we had a very brief conversation, Ross. This wasn't where my dad, we spent hours in processing. He was a man of his generation. And so he never brought it up again because you know why? Somebody finally heard him and listened. So that story to me is instructive in all things with our parents. As caregivers, we get focused on the practical and we often are anxious about what we can see as safety needs. But what we have to do is address how this feels to our parent, the emotional. We have to acknowledge that piece. So that's what I teach people to do now, to come in and acknowledge it from the emotional. You're still going to deal with the practical, but oh my gosh, we all deserve to have somebody acknowledge how these changes are impacting us. And we miss this a lot when we're caregiving. I consistently see caregivers struggle with this. I got to get this fixed. I got to get this fixed. And I'm like, well, how is your parent feeling? Well, we haven't really talked about that. So that's my, if anybody gets a takeaway, that would be the one I hope they take away.
Well, in our world, especially with our practice, we call that human first. And
yes.
It's so easy as professionals to go to the technical, to go to the practical.
Totally.
I literally just had a meeting, I don't know, an hour ago with someone who was in a medical meeting with a doctor, and the doctor came in and just shared diagnoses that were gut-wrenching and just did it deadpan with no recognition whatsoever. And it was a parent and a child situation. And this person was at the edge of tears. And the doctor just never caught it. And we had our conversation about, every business, any person that works with other people, you have to think human first,
You
because
do.
sometimes it's life and death, or sometimes it just feels like life and death. But to
Right.
just go in and just start talking about it, it's just such an easy mistake for people to make.
It is. And I do that same kind of work with advisors because it's, to me, this is, if we could just get empathy, empathy. And, empathy is just, to me, conveying to somebody, I see you, I hear you, I get you, I get what you're going through. And we get that almost nowhere in our lives. If you look at how infrequently people get genuine empathy, making that connection. And as caregivers, we're busy, we're stressed. And it's not that we mean to do that to our parents, but we're just focused on the practical aspects. So human first, you're right. I always say, that's all that matters, right? Is the human connection. I think one of our greatest human needs is to feel heard and understood. And that's what, in that moment in that car with my dad, I got it in a way I hadn't realized before. Again, I have a PhD in social work. You would think this would just flow out of me, but I have a 20-year-old daughter who would reassure you that it doesn't just always flow out of me. I have to sometimes back up and redo it too.
Yeah, for whatever reason, it's just not instinctive to us when we have a technical type of business or
Right.
job. It just doesn't
Right.
come out. And as I'm listening to you, I'm thinking Brene Brown, Atlas of the Heart, compare
Yes.
sympathy and empathy.
Yeah, that's right.
Sympathy maybe is instinctive. You're like, oh, that stinks. But the empathy to actually recognize that person, what they're going through, you just got to be intentional with that. I don't know. Is it just not instinctive to people?
I don't think it is. And I think very few of us have good role models of this, consistently good role models. And I think we value so much sometimes getting things done. And I do think in the case of caregivers, fear really does interfere with this. Like their caregivers are, when I work with them, they're often so afraid about their parents, safety or something going on. And I spent a decade caregiving. I know that feeling. I had it with my mom was quite disabled and my dad was there, but he was alone for 3 years. And so I remember that feeling of fear. And I got better at just saying to him, Dad, I'm a little worried about this. But how about if we give it a try? But just so you know, I don't know if this that we're trying is going to work. So I stopped trying to just barrel in and fix it and more partner with him and give him his voice back. And it made a huge difference, Ross, in how it was perceived. And, the thing is, I was young when I did this. My parents needed care when I was in my 30s. So I've had a lot more life experience now. Some of this stuff, I have that feeling that probably every caregiver has and every parent has. If I could go back now and and redo this, I've learned so much. But so what I try to do is share this wisdom with caregivers who also increase my wisdom every time I work with them.
Well, I appreciate you mentioning your parents. So why don't we address that? So what if I have to approach a spouse who needs
Uh-huh.
care and may not know it? How is that different from approaching parents?
Yeah, and it's caregiving for a spouse brings up very different issues. Obviously, this one's a little trickier a lot of times for people because it's you've had a certain relationship that's partnered, and so now I want to remain where I keep you my partner, not just somebody I'm taking care of. So how do I open these conversations so you feel engaged in the care, you still feel like you have a voice? And one of the things I see with spouses, and I'm thinking now especially older spouses caring for each other, they often feel they have to do everything. Like, I'm the one who has to take care of my spouse. This is my job as husband or as wife. And so sometimes they don't seek out help as often as adult kids do. So if you're an adult child and you've got two parents, and one's caring for the other, I really, really encourage you to say to your spouse, caregiving is not a solo journey. And what your goal is as a spouse is to make sure that the person, your spouse, gets the best care possible, not that you do it all. And that's different. As a matter of fact, you can't typically do it all for the long run. Caregiving's, it's not a sprint, it's a marathon. So I say to spouses, helping get the best care possible is what you want to do. It's not doing everything for your spouse.
Any final thoughts or any takeaways that you want to make sure you mention?
I think this idea of supporting people's quality of life and independence and opening conversations that way, and just remembering as caregivers, you've heard me describe in my own life. Probably you'll do things you wish you hadn't done, but you can back up and fix it. Just like you can, I go back sometimes and have conversations with my dad and say, oh, I thought about what we talked about and I wished I'd said this to you. So it's okay. I think the more we can have these essential conversations though, Ross, again, talking to the most important people about the most important things in our lives, essential conversations, open the dialogue, talk early and often. That's the best approach.
Appreciate it. Dr. Amy, thanks for so much for being on the show and sharing. I'm sure I could do this for hours with you, but thank you.
Thanks, Ross. I appreciate the opportunity.